Clinical Monday, the best way to begin a healthy week. It's a happy Monday to you and yours, and thank you so much for joining us, and welcome to the episode. Today, courtesy of, I want to say Orampop in Ehlanzeni, but we are somewhere, and I hope the background gives it away, and we are joined by two guests today to dissect yet another clinical topic. We are talking antibiotics. Listen, I have not even introduced myself just because of this excitement that I'm feeling. My name is Vee Ka Nkosi, and I am your host behind the scenes at Phaleng, making sure that we are coming up, and other stuff. Please make sure that you are part of this conversation by leaving the comment section on the comments section and any other questions that you might have. Like I said, we are talking antibiotics. A lot of people use antibiotics for everything. You have flu, they say antibiotics. You have something else, they say antibiotics. You have a headache, antibiotics. So we want to shine the spotlight on that. Please find us on other social media platforms. We are live on Orampop's Facebook page and also on X. It is at Pop in Health with the hashtag Clinical Monday. You can catch this episode if you've missed it on live on our YouTube channel, also www.popin.org. So today I'm joined by Dr. Mhlongo and
Bianca Khumalo,
yes.
Medical Associate.
That's right, and they are here to speak to us about that. So thank you so much both for making time for us. Really appreciate it. Let's just jump straight into it. I guess maybe the first question is it safe to use antibiotics for every condition or illness?
No, because antibiotics are mainly used for bacterial infections, and not every illness or condition is caused by bacterial infection.
Yeah. And, well, do you want to perhaps maybe, unpack what a bacterial infection is versus what is not? So that we sort of like have a clear, indication of what is and what isn't.
So it's basically on the makeup,
Yeah.
of the organism. So it's two different organisms. The other one has a cell wall, the other one doesn't.
Yeah.
Right? Antibiotics themselves, they act on the cell wall, which bacteria have, and viruses do not have that.
Okay. Okay, that's clear. And can antibiotics treat viral infections? I guess the answer would be no. I want to say like colds and flu.
No. Even like some fungal infections, actually, it doesn't treat that. Yeah.
So you must stop taking antibiotics when you have flu.
No, you mustn't take antibiotics when you have flu, because flu is caused by a viral infection. So what you're actually doing at that point in time is you're actually harming yourself. Because remember, antibiotics have side effects, so you need to stay away from that. And besides that, because some antibiotics, given the spectrum, right, they'll actually also take away some of the good bacteria that you have and immunity.
I got you. And I guess perhaps let's unpack the risk of using antibiotics when there is no need. Like we just spoke about flu. There's no need for us to take antibiotics for that, but what would be then the risk if we take antibiotics?
Okay, so if you take antibiotics unnecessarily, you may develop antibiotic resistance, right? So it means that now, when you are actually sick and you need those antibiotics, it won't work.
Yeah.
And then another thing is that you are, as he said, you're damaging your good flora, right? Your good bacteria.
Yeah.
And then also, there's many side effects to antibiotics, which usually are not unpacked when you take antibiotics. And usually most people actually take them unprescribed. They're like, I got them from my jaw, or I got them from my sister, so like,
We say antibiotics.
Antibiotics.
Yeah, I got you. And can overusing antibiotics make them less effective in the future, especially if now there is a need for you to take it?
Yes.
Yeah.
Because as I just said, you develop antibiotic resistance, right? So that specific antibiotic that you took will no longer work for that bacteria.
Yeah.
So now every time you're sick and you try to take the antibiotic, it won't work. Now the issue will actually escalate. Yeah, you become more sick. Nothing will work. You will result in maybe more expensive antibiotics.
So there's a sort of like price range.
There's a protocol.
Protocol.
Yeah. So based on what you currently susceptible to, right? So that's how we actually supposed to prescribe antibiotics. And antibiotics themselves are supposed to be actually governed by the antibiotics George, right? Which is the one that we're supposed to follow to actually, provide like effective prescribing and for the right, for the right things, for the right person, and for the right organism, basically. Yeah.
Got you. I want to say, you spoke about the overuse and the risk, but how does it happen in terms of the resistance when the antibiotic then becomes, or when the body becomes resistant? Like, how does that resistance happen when you have taken them over and over and over again?
Okay. So, like any other organism, there's something called natural selection, right? So, over time, the overuse, it causes the bacteria to basically now genetically become genetically unsusceptible to that, because what it does when you continuously use it, then it gets exposed, like yourself. If someone is jamming, you start developing those and then hard stuff to actually try and adapt. Right? So and most organisms actually do adapt. So the continuous use, it causes it to genetically it alters its genetic makeup, right? And then now that one that already has a genetic makeup that has been altered will then now also reproduce others that are no longer susceptible to that. Yeah. So that's basically how it happens. Yeah.
Interesting. And what should I do if I feel better? Let's say I came in with an infection and I'm prescribed and I have those antibiotics. I say let's say the course is 12 weeks is a lot, but it's a week, and on day 4 I feel better. Should I
continue using it? Don't stop.
But I feel bad.
No.
But my I feel better.
Always take the full duration that your doctor or provider prescribed for you. Never just because you feel better, never just stop on your own.
I got you.
That's how you develop the resistance.
Okay.
So basically the ones that are not, because if you feel better, it means you have basically lesser colony, right? But the remaining colony can actually develop resistance and then just come back and then now no longer be susceptible to the antibiotics that you have. So you must always make sure that you eliminate the entire colony that's actually there.
Interesting. Listen, what are some of your questions when it comes to antibiotics? What have you used antibiotics for? And was it meant for that? Or, that sharing of antibiotics, I have something, do you have a pill? Because it happens a lot I'm not saying in our culture, but in our community, where everybody just shares antibiotics. Please share some of your comments with us on your comment section below. We're still continuing with the conversation. We spoke about the risk and how that resistance happens. And the other question is, can taking antibiotics for wrong illnesses have any good? I'm assuming, because it's all an assumption, I'm assuming that if I take the antibiotics, like I said, the mentality is it clears everything. I'm thinking that I'm even taking care of that infection, or I don't want to say disease, but infection that I have, assuming that it's going to help. It doesn't?
No.
If it's not meant for it?
No. So we've already, noted as you kind of cause more harm, right? And at the end of the day, you're not even going to get the benefit of the antibiotic. You're still going to have the illness, and then now you're going to experience all the side effects that come with it. And then the other thing that is likely to happen is a lot of people get what we call C. diff, where they get this diarrhea because now you've taken out all the good bacteria, and then now you have diarrhea because now you're left with bad bacteria. You know what I mean? So so that's one of the things, and you can also get allergic reactions or anaphylaxis basically, because so a lot of people get those reactions from antibiotics. So now you're getting all the bad things without the benefit, because remember, any medication is based on a risk-benefit stratification or analysis.
I want us to sort of maybe do a set of illnesses that antibiotics can that are general or common that can deal with, versus those that can't. You know what I mean? So 2 illnesses that if I take antibiotics, I'll be fine. Obviously, it will be accompanied by other medicines, versus 2 infections or illnesses that antibiotics can't solve, whether you take them, it's still the same.
Okay, one illness that maybe antibiotics can help, well, depending on the type of antibiotics, obviously. Most common is a UTI, urinary tract infection. Another thing is if you have bacterial pneumonia, probably,
Yeah, those are the two that need antibiotics.
Yes.
Okay, ones that don't.
That don't need antibiotics.
Basically, not those.
Yeah, so in relation to that, like, your viral infections, like the ones that I've already noted, like colds and flu. Yes, it can happen at some point that, you can start with the cold, where everything is clear, your sputum is clear, but then you can have a superimposed bacterial infection where now your sputum actually changes color, and you can see it's yellow or green, and then now there is actually a bacterial infection. But if it's just the viral infection that's causing those symptoms, you don't need antibiotics. You don't need antibiotics for fungal infections. We've got antifungals for that, right? So those are basically the things that you don't need antibiotics for, and a host of other things. But I mean, you said two, so
let's keep it two. Speaking of two last questions, and then we wrap up. How do I know if I really need antibiotics? And I think we should run away from self-diagnosing. Like, I have this and I think I can take antibiotics. So
because we get that a lot. Like, people are like, I've got a flu. Can you prescribe antibiotics for me? And like,
no, they come already. No, what?
Exactly. So when do I really know that I really need antibiotics? Would it be on presenting symptoms, or what I think I have, or upon consultation?
Yeah, so basically go to your medical provider. So based on your symptoms, you'll tell them what you have, they'll examine you, and then based on that, they'll make an informed decision on whether you need antibiotics or not. So a person shouldn't come and say, hey, I need antibiotics.
Because it happens all the time. And even for, because I think the problem is not only with the patient, it's also with the healthcare professionals. They always succumb to what the patient is saying, and sometimes they themselves, they feel that, okay, if I give this person antibiotics, I also later on because I gave them what they wanted, which is not how we should practice, or which is not what the antibiotic stewardship entails. You need to do the right stuff for the right patient for the right thing. You get what I'm saying? So basically,
When they come in, which is the last question, what should they ask? Perhaps maybe what should they ask? What should they ask a doctor before starting on antibiotics? What would be, I want to say, frequently asked questions about antibiotics before they start on them?
Possibly what exactly antibiotic they're taking, the side effects it can cause, and then also the duration, when I should actually take the antibiotics, with food, without food. Also,
Got you. Anything to add?
I think she's covered most of the things. So it's basically that how to take them, and also how long the course is going to be, the importance of the definition of course, etc. And when to come back,
Got you. Listen, Bianca and Dr. Mhlongo, thank you so much for your time. Really appreciate it. I hope you've got your insights when it comes to antibiotics. Antibiotics. Consult your healthcare professional for that. They've been quite amazing, and I hope you've learned a thing or two. Until the next episode, thank you so much for streaming. Bye.